My name is Tim Fargo. I'm a chiropractor.
My name's Chuck Svensson. My medical practice is called, funny enough, Svensson Medical.
I am Jay Oppenheim. I am an injury recovery and longevity trainer and wellness coach.
My name is Dr. Rich Joseph. I have a private medical practice. It's called Vim Medicine.
I'm Emily Meidinger. I work at CrossFit Edina. I'm a chiropractor by trade.
I'm Erica. I am a physician. I've been practicing since 2001.
My name's Hake. I'm an emergency medicine specialist. I've been out of residency since 2002.
I've had a lifelong interest in health and fitness, and so my job as a chiropractor is really an outgrowth of that. It's a personal passion for me.
I've spent a few decades in the medical system. I do bariatric surgery. I help people with losing weight, both medically and surgically. Part of my issue is it's really fun to help somebody who's having so many issues with their health because of their weight. But what I really like to do is help prevent people from ever getting there. And that's really what my practice is about.
My business is Optimal Personal Performance, Fitness for short. And it's a business that first and foremost focuses on injury prevention, people who have injuries who are currently in physical therapy, or people who are post-physical therapy, to really help them take their injury recovery to the next level.
My background is in strength and conditioning. I always knew that I wanted to build a clinical model that fused the world of proactive health and movement with preventive care, so it helps clients think about their performance now as well as their longevity into the future. Human-powered health is unique because of the expertise of the people who are doing the testing here. I feel very comfortable sending my clients here knowing that they're getting the best high-quality testing from people who have a background to do the testing.
Using HPH, it's just giving me a standardization of health. I can do the lab ordering piece of that, but I can't see their body as a whole scan from a baseline test to where we're at in the future. And so there's experts here that can interpret the results, and it's not just you laying on the table, they do the scan, and then you're out the door.
I don't really know anybody in the area who's providing the set of services that provide the data that's specifically oriented to performance and health versus detection of disease.
As doctors, we're always kind of changing and growing and responding to our curiosities intellectually. But there comes a point, I think, where you realize that you also have to change and review your philosophy in terms of how you manage your own body.
And some of it has to do with the emphasis or the lack of emphasis that modern medicine puts on things which quite clearly have been demonstrated to be of benefit in increasing somebody's health span, as a sort of a counterpart to the idea of lifespan, which you can measure by birth certificate and death certificate. Health span is the number of years you exist without sort of disabling chronic illness. And it turns out that there's a big gap in between somebody's health span and lifespan. So we really feel that our job, our mission, is to try to bring those two numbers as close together as possible.
Everything that I do is data driven, and so I want to know not just what their body fat percentage is. I for the most part, I don't really care what their body fat percentage is. I want to know more detail. I want to know what their muscle mass is. I want to know their ALMI, their appendicular lean muscle index, how much muscle they're carrying on them. I want to know their VAT, or their visceral adipose tissue, because that's going to help me direct any cares interventions that I do for the patients. And I really need the data to do that. So I can get that data from Human-Powered Health.
Human-Powered Health gives my clients easy access to these data-driven metrics to help them be aware of where they are in their fitness and health journey. From there, I hope to help clients evolve to longevity fitness. Longevity fitness is a focus on things like bone density, lean muscle mass. Just overall, you can function higher and better for many years to come.
Our focus is really not just acute pain relief care, but rather helping people restore and maintain optimal health and function throughout their whole lives. So I have people that have been with me as patients for 40 years, and we're just going to grow old together.
I have patients that are 40 years old and are triathletes, and I've got patients that are almost 80 years old. So it's a very different need, but I can send all of them to HPH, know that they're going to get great care, they're going to get great evaluation, and anything I can possibly want, they can do here.
I think both my practice, Vim Medicine, and Human-Powered Health share the common ethos and philosophy that health is an ongoing endeavor where the individual is the true owner and the agent responsible. And by that, true health is self-made.